take a seat and we will get going. Right, okay. So the first thing we're going to have a look at is your skin for your eczema. Is that right? Is that alright? So how do you feel like your eczema's getting on? Right, okay. Well, just looking at your face, it seems to have cleared up a lot from when I last saw you. Well, I'm going to have get a little bit closer to your face, and I'm just going to have a little look, okay? Yeah. Right, let's have a look. It is a little bit dry, but I wouldn't say there's any great reason to carry on the eczema cream. So I think we're going to knock that eczema cream on the head, yeah? Do you agree? Have you got it anywhere else over your body, or was it just the face? Right, okay. I'm happy for you to use what you've got left, but other than that, I've discontinued it, so you won't get another prescription for it, okay? What was your codeine on? Yeah, I see now. And you were taking that for your arm, weren't you? Can I have a quick look at your arm? Which arm was it? This one? Right, okay, I'll just have a quick look. Does it hurt when I'm touching you there? Okay, what about now? What about now? Can you bend your arms up and straight to the side and then in and then forward? Right, is there any pain at all there? And do you get any pain moving it, or? Well, I think I'm going to stop them as well before you get addicted to them, because they are quite addictive. You've been suffering with a bit of depression and a bit of anxiety. How are you getting on with that? So as your mood swings calm down, they got worse. They've calmed down. Right, okay, what about your anxiety? So you're having talking therapy, that's good, that's really good. Right, okay. So, would you be happy for me just to leave at the dosage that you're at? Yeah, no, I can do that. How many of them have you got left? Right, okay. Right, so I've got another prescription gone in for you, so that'll be ready in a couple of days. Just go to your pharmacy. Anything else that you want to talk about with your depression and anxiety, or do you think that your talking therapy is helping? Is there anything else that you think I could do for you? Right, okay. Well, if you think of anything, you can always let your own doctor know, or your talking therapy, and they can do a referral back to me and we can have another chat about things. Okay, good. It's good to see you smiling anyways. Right. So you've been going for acupuncture on your head for migraines, and you've been going there for 4 months. So how is that? How do you feel like that's getting on? Right, okay, so how long would you say that acupuncture is working for? Right, okay. Because the acupuncture should work for about 4 to 6 months. And if you're saying that you're only getting about 4, I would have liked to have seen it working for the whole 6 months. How would you feel if I bumped that up? So you get acupuncture every 4 months instead of every 6. Because obviously I don't want you to be in pain for 2 months before you go for it. How would you feel about that? Right, I can bump it up, yeah. So then obviously I know as well, because I've just seen it, where's it at? There it is. That you were concerned about some hair loss. Is that still your worry? Good. I'm glad you're not worried about that no more. If you do ever worry about it again, you know, you can go to your GP and either they will have a look or you will get referred on. Okay, so don't be worried about that. I can't see. Can't see anywhere, but have you had your COVID vaccine? No, right. How do you feel about me booking you in for it? 50-50. So would you like me to book you in, or do you want to think about it? Well, I can have a look, see when the next date is. So I could do it a week today. Do you want me to book you in for that? What time are you looking at? 12 to, yeah, I've got about 12:30, that's alright. When was the last time that you got tested? So if I book you in to get tested the same day, yeah. Right. Right, so obviously you got a bit of a bump to the head as well. In the wars, eh? So I'm just gonna have a quick look on your, like, the back of your head there, and just make sure that everything's healing up alright, okay? Right, that's great. Yeah, it definitely looks like it's healed up. Yeah, no, I'm not worried about that at all, because I know that you've been complaining just a little bit about these pains. So let's have a quick listen. It's going to be a little bit cold. Try and warm it up for you. Right, sit tall and just breathe normally, okay? Right. And at the back, can you cough? And again. Okay. Now cough. And again. Yeah, now everything seems to be fine there. Well, obviously if they just come on and they're not happening now, I can't rule anything out. So what I'm going to say is I'm going to put you in for a 24 ECG, and basically you'll go probably back to me. I'll fit the ECG and then you'll go home for 24 hours, come back the same time I put it on, and then I'll know the results. How does that sound? Okay. In actual fact, am I free tomorrow? Are you free tomorrow? Yeah. Right. What time are you free? I'm free about 3 o'clock. Also, I just wanted to quickly talk about, have you had the nose, like jab? It's just a spray. No? Would you like it? It's not actually me that does that one, so I'll have to get you a letter sent out. It's like a 2-second thing. Can I just have a quick look inside your mouth? Yeah, just open up for me. Yeah, that's fine. And I know that there was a bit of talk about you going to a diabetes clinic. Have you been for that yet? No. Right, I'll get that chased up. I think they just wanted to give you a little check, just to make sure. So it says here that your hearing and smell tests came back good. Get to it. How's your neck feeling? Can you move it? That side, up, down. Right, let me just have a quick look at it, okay? Yeah. Is there any pain there? No, that's perfect. Is there anything else that you would like me to check, talk about, or anything like that before I go? Are you sure? Okay then. Well, I hope that was okay for you. And are you pleased with everything that's going on with you so far? Oh well. Well, I hope it continues and you have no more knocks and box. No more knocks and you know what I'm saying.